According to the Mental Health Association in Delaware, mental illness is a major public health problem, with 1 in 5 Americans experiencing depression or anxiety disorders every year. This means more than 100,000 Delawareans, including children, are affected by these illnesses annually. Depression, if left untreated, is as costly to the American economy as heart disease or AIDS. According to the National Institute of Mental Health, the annual cost of depression in the United States is estimated to be $43.7 billion in loss of productivity, absenteeism, treatment costs, and mortality. The Mental Health Association in Delaware, MHA, is a statewide nonprofit organization. MHA provides services throughout Delaware and focuses on education, support, and advocacy for mental health issues. Today, I will share a 3-part conversation about mental illness, suicide awareness, substance use disorder with 3 individuals who have battled and overcame. Meet Natalie Claus-Rogers, Mental Health Association peer educator. Like many peer educators, Natalie has lived with depression and now helps others live positive lives despite their illness.
I have lived experience with depression. When I was 19, 20, things they weren't right, and I started to feel depressed, and it escalated from there. I received a diagnosis, and not long after I received a diagnosis, I had a credible suicide attempt, and so it was a long battle, but I finally found that journey towards recovery, and I ended up here.
Depression is not easy to talk about or explain. Natalie shared her interpretation of the illness.
Depression is it's a fog. It's a monster in and of itself, and I think that it's a disease. It's not curable, but it's treatable, and you have to learn to gain control over it. Only you can help you. You have to be the head of your recovery team. Doctors are important, therapists are important, medication is important, peers are important. I'm a little biased about that, but you are the #1 person on your treatment team. It's up to you. And sometimes that's a little discouraging at first, like what, there's no magical cure or there's no magical pill, but once you learn what you can do to help you, then it's empowering.
Everyone may not understand what it feels like to live with depression, but people like Natalie work to bring about awareness.
I had family members call me crazy. I had friends that I thought would be forever friends that weren't. But then I had people that I thought that were casual acquaintances that became forever friends. The way people react to mental illness, that's one of the things we as peers are trying to stomp, is that stigma, because people's reaction, if I said I was fighting cancer, which is a very important thing, the reaction is much different from them when you talk about your battle with mental illness, and we want that to change, because it is a disease, and it is something, that it is a sickness, and it's something that's treatable and that we're working on. And unfortunately, TV and movies doesn't do us any favors. It does have a lot of stigma involved, but that's changing.
Peer educators are known to play a major role with mental illness treatment.
There's a guy walking down the street, and he falls into a hole, and the walls are so steep he can't get out. And a doctor passes by, and the guy shouts up, "Hey, can you help me out?" And the doctor writes a prescription and throws it down in the hole, and he moves on. And then a clergyman comes along, and the guy shouts up, "Reverend, I'm down in this hole, can you help me out?" And the clergyman writes out a prayer, throws it down in the hole, and he moves on. Then a friend walks by. "Hey buddy, it's me, can you help me out?" And the friend jumps in the hole, and our guy says, "Are you stupid? Now we're both down in the hole." And the friend says, "Yeah, but I've been down here before, and I know the way out."
Natalie believes paying attention to the signs can save you from returning down the dark path of depression.
Of course, and I know the signs. That's one of the things we teach as peers, is we know when things are going a little bit downhill. We teach WRAP, Wellness Recovery Action Plan, and we have tools in our toolbox for when things are going downhill. What do we do? Maybe I need to journal a little more. Maybe I need to talk to my husband and tell him I'm not feeling as well. Can he watch the kids a little more? We have kind of an action plan for what happens when things are not as going as well as they could, and I know those signs, so that way I'm not going to end up back in the hole, because I know when I'm sliding down.
Like any other illness left untreated, it can cause an array of health problems. If you need help or looking for some resources to help someone you know, please contact the Mental Health Association at 302-654-6833.